Well, good morning. Good morning, everyone. My name is Adam Scholler. I am the Vice Chair of the Board of the Coalition on Aging. And you're pretty much looking at my responsibility in that role is to stand in when Mary Bethel is not available. So on her behalf and on behalf of the board, welcome to the January membership meeting of the Coalition. I've been allotted 5 minutes for opening remarks. I've taken all the time I intend to. So Dick, I'm going to turn it over to you for the Secretary Treasurer's report, and then just feel free to go right into the financial update. Oh, and I think Dick, you're on mute.
Yeah.
Okay. It's starting again. Good morning, everybody. It's good to see you all. Happy New Year. You probably saw the financial report in the email that Heather sent around, and our balance has been going up because we've been getting lots of memberships around and sponsorships around the first of the year, and also some grants that we were due. So you can see the balance in December was about 130,000, I believe. And are there any questions about that report? If there are no questions, I guess we'll consider approved, and you can always email me later if you have some questions. And Adam, should we also do the minutes now?
Yes, that'd be great. Thanks, Dick.
Yeah. Okay. And you also got the minutes from December. Are there any corrections or comments on the minutes? Well, we're just doing perfect work here, aren't we? Okay. Well, we'll consider those approved too. And the same thing, you can always ask me about any questions. So I'll turn it back to Adam.
All right. Thanks, Dick. And thanks for all your hard work in the role of both Secretary and Treasurer. Certainly doing a good job and keeping us all informed and on track financially and from a governance perspective. So we appreciate everything that you do. Heather, I am going to turn it to you and ask you, if you would, to please carry us through the remainder of our agenda and introduce our speakers, and just proceed based on the agenda that was sent out to everyone. And I will go on mute and let you run it from here.
Great. Thanks, Adam. I appreciate it. And I appreciate you stepping in, and excited to be here today with everybody, getting a good start to the new year. We're have decided to go ahead just for a efficiency standpoint, for a lot of reasons, to do our guest speakers first off. That way we can give them space and time on our agenda that's really just definite. Sometimes I know our conversations get sidetracked and we get on different tangents. And so when we put our speakers at the beginning, it just allows us to give them a real hard start time. And also then they can exit and go on with their day, and always are welcome to be part of our whole meeting. So just know that all of you are welcome to be part of this meeting, and they're open to anyone. So, but we know folks are busy and have lots to do. And so we're really fortunate today to have 3 fantastic updates to get us kicked off with the new year. I think all of you know that the Coalition on Aging has worked closely with PHI, which is a think tank, national think tank on direct care workforce issues out of New York. And Kezia Scale has been a longstanding contributor, and we've done phenomenal work on developing an advocacy roadmap. And so just earlier this month, PHI has released a index on direct care workers, comparing states across different domains. And we felt like, because the coalition has worked so tirelessly on direct care workforce issues, it's something that's important to so many of you, that we wanted to pull in our friends at PHI to give us a little insight to the index, so that we can feel more informed when we're talking about it and sharing it with others. So that's our first off speaker. And I'll get back to Lina in a second. The next is Howard Bedlin, and Howard is with the National Council on Aging. He'll be able to join us from 10:30 to 11. We've got hard start and stop dates for Howard, but Howard is a fantastic friend of the coalition. He came to our annual meeting several years ago. I think it was maybe 2018 to provide federal updates, but he's the government and advocacy principal at the National Council on Aging. So he's been doing tons of work on the budget and also the Inflation Act, and will talk to us about some other things going on at the federal level. And then we are changing it up a little bit, and Rebecca Freeman from the Division of Aging and Adult Services here to tell us what they're doing within DHHS and within the division with some of their initiatives. So we've had to change up Joyce Massey Smith. She got called to a meeting with senior leadership in DHHS, but we're so glad Rebecca's here. So with that, we'll go ahead and get started. And so Lina Stepick is a relatively new employee to PHI, and so she's getting her feet wet there. But Lina is a senior research and evaluation associate there at PHI, and really looking at those evidence-based state and national policies on workforce innovations that improve the quality of direct care jobs and the quality of long-term services and supports for older adults and people with disabilities. Prior to joining PHI, Lina led the economy research of senior researcher at the Federal Reserve Bank in San Francisco, and was also on the faculty of the University of Oregon and their Labor Education Research Center. So really great, rich background there, especially on the labor side, and a great mix with direct care workers. So Lina, I will turn it over to you to get us started and to have conversation about the index.
Wonderful. Thank you so much, Heather. And thank you all for inviting me. So I'm trying to share my screen. Let's see if I can get this to work.
I see it.
Yeah.
Yeah.
Is it loading a slide just yet?
It looks like it. It's totally loaded. And
Wonderful.
I am going to go ahead and for the sake of folks, I'll put into the chat box the index that we're talking about, the link, I think.
Thank
so
you.
Go ahead and get started. Yeah.
Wonderful. So good morning. Yes, thank you all so much for welcoming me into this space, for inviting PHI. As Heather shared, my name is Lina Stepick. My pronouns are they, them. I'm a senior researcher with PHI, started a couple of months ago, and I'm a mixed methods labor sociologist. I'm actually based in Oregon. I'm originally from Miami. I'm so excited to hear about all of the amazing work you all are doing in North Carolina. And today I'll be sharing a little bit about the state index that Heather mentioned. So PHI has developed a direct care workforce state index. It's an interactive online tool, and it was released earlier this month. We're hopeful that it will be useful to folks like you all and support your efforts to improve direct care worker job quality. So I'll share a bit more about the tool, look through some of the characteristics we can look at, some of the measures, and then I'd love to hear any of your thoughts, your immediate reactions, questions, anything that comes to mind for you. So the state index is an interactive data-driven tool that gives a picture, a snapshot of how states' public policies support direct care workers and how these workers are faring economically in each state and comparatively. This landing page has this beautiful color-coded map. It's color-coded by quartile ranking that we'll get into a little bit more of how states are faring and where they can improve. And users can select different states. So you can go in and click on North Carolina or similarly situated states to see if you want a more regional comparison. And get a more complete picture of everything that's going on that's recorded in the index. There's also a button here I want to point out that says FAQ and methodology, and that gives you more detail about each and every measure that's included, what the data source is, what we're thinking when we included it, all of that. And so as I'm guessing everyone on this call already is very familiar, the direct care workforce. Here we're talking about home health aides, personal care aides, and nursing assistants who support older adults and disabled individuals with activities of daily living across different care settings, is a very large and very fast growing occupation. There are about 4.7 million direct care workers nationally, according to recent data, and about 112,630, according again to this recent federal data, in North Carolina. And this workforce is projected to add more jobs by 2030 than any other occupation in the country. Due to high turnover, departures from the occupation, departures from the labor force, we also know that there will be an even larger number of total job openings due to that churn. So new jobs added, but then folks leaving, and so even more job openings all the time. However, despite this growing size and what we know is the enormous value of this essential workforce, these occupations are characterized still by low wages, few benefits, unstable hours, limited training and support, and other factors impacting job quality and direct care worker economic outcomes. There has been a small increase thanks to a lot of the work that folks like you have been doing, and thanks to the attention of the pandemic on this workforce. So a small increase in hourly wages in recent years, but large proportions of this workforce continue to live in poverty. Our hope is that this state index can provide an extensive state level data, cross-state comparisons to support efforts, like I mentioned, to change that picture and continue to build out the needed policy infrastructure to improve direct care worker job quality. So the index enables users to rank and compare all 50 states plus the District of Columbia, so it'll be out of 51. And it's based on 2 composite measures that includes policies and economic status of direct care workers. I'll get into some more details about what's included here. So the first one is a worker supportive policies index, and that includes both direct care worker specific policies, things like what are direct care workers, wage rates, training requirements, is there a wage pass-through policy, a matching service registry, things specific to this workforce in each state. And then we also have universal worker policies. Is there a state minimum wage that's higher than the federal minimum wage? Is there Medicaid expansion in the state? Are there paid leave policies, a state level EITC, protections for LGBTQ workers, and more? And then the second measure and composite score is the direct care worker economic index. So how are folks faring economically in the state in this workforce? Includes the median wage for direct care workers, but also I think an interesting measure of wage competitiveness. So how that median wage for direct care workers compares to one for other jobs with similar entry-level requirements. Basically, can direct care workers go and earn a few dollars more per hour working in a different industry without any additional education or training necessarily? Also, we're including their median annual personal earnings, since we know that's impacted by unstable hours. The poverty status, housing cost burden. So basically, are folks spending 30% or more of their income on housing? We know that varies regionally and certainly by state. So we want to make sure that that's state specific. We're not comparing folks in North Carolina to California, but very specifically, what is the regional context there? And health insurance coverage, or really lack thereof. So getting into using this tool, basically you had that landing page with the map. If you click on North Carolina, this pops up. You get, and then you can scroll down. So we'll go through all of it. You get a state profile. And the first thing that you see are these key characteristics of the direct care workforce in that state. And I wanted to make sure to highlight that these are pulled from PHI's longstanding other online tool, which is the Direct Care Workforce Data Center. And so if you haven't ever or recently dug around in that tool, I highly recommend looking through there because these are just a snapshot of what you can find. It's basically all of the nationally available, publicly available data analyzed for this workforce by state and nationally, and it has more detail on where these figures come from. But just briefly, it shows you the size of the workforce, the projected growth, and again, that is the new jobs added and the total job openings due to that turnover and churn in the workforce, and then a couple of demographic key facts about the workforce in the state as well. I also wanted to note that up in the right corner, you can see download PDF. So in case it's useful for your purposes to have a PDF version that you can print out, take to state leaders or whomever, there's that option as well. Then as you scroll down, you'll see the overall ranking. So again, it's out of 51. And then you'll see the ranking for that first composite score that I mentioned, which is the Worker Supportive Policies Index. As you keep scrolling, you'll see each measure that's included in each of these composite scores, right? So you can see where North Carolina has quite a few personal care aid training standards, which again, I would imagine is thanks to a lot of folks on this call, and where, and I, as an eternal optimist, keep framing it in my head and to others as where there are other policies that have not yet passed, because we know that folks have been working on so many different efforts in different states. And then you see the Direct Care Workforce Economic Index, and you can see more detail on each measure for that as well. And then a key part of the interactive element of the tool is that there are visuals for each and every measure. So you can click compare. If you look on the right side, there's a little graphic for each one. Click, oops, sorry about that. Click compare. And what pops up are two different kinds of graphics depending on what the measure is. So if it's a binary variable, one coded yes or no, for example, we have paid sick leave here. Does a state have a paid sick leave policy at this time? Yes or no? And so you can see in alphabetical order where states are. If it's a numeric variable, such as the percentage of direct care workers in the state who are uninsured, so lacking any form of health insurance, then you'll see a bar graph, and the state that you're looking at, in this case, North Carolina, is highlighted. And you can see what tier folks are in. Are they doing well, or is there room for improvement? And to be clear, there's room for improvement in every single state. And so as useful as we hope this tool is, as researchers, we always want to be very mindful and very transparent about limitations and share those up front. So a lot of thought went into all of the measures that are included here, how they're analyzed, weighted, but no tool is perfect. No index is perfect or totally comprehensive. This does not capture policy in progress, as again, we know folks have been working many years on many forms of policy, so we hope to update it regularly. But it is very clearly a snapshot in time. It also doesn't reflect the complexity and nuance of each state environment. That's very clear. But we hope that there can be some regional comparison to other states, maybe with other similar political organizing environments. And the rankings are approximate. As I mentioned, we want to be very, very clear. Even the top ranked states have plenty of room and opportunity for improvement. Like I mentioned, even in the top ranked states, large proportions of direct care workers continue to live in poverty. And we know that with the growth of this occupation and the high need, that is just not sustainable. Some next steps. We would love you to visit the tool now at any point in time and play around, see what works, what doesn't. We've already benefited greatly from feedback from Heather and other state partners when it was first released, like, oh, this wasn't loading properly. Where do I find the methodology? Questions like that, very welcome, but also any reactions of, I'm not sure I understand how this bar graph is set up, or maybe it would be more useful for the PDF to include some measure or some context. And as I mentioned, PHI plans to update the state index regularly, but that feedback's welcome absolutely anytime. We're also planning to release a paper that has some supporting analysis, gives a little bit more context, and some how-to guides to walk folks through this in a little bit more detail, kind of similarly to today, but any feedback on how that might be more helpful is very welcome as well. And I have my email here, so please don't hesitate to reach out with any questions, reactions, thoughts, ideas, and I think we have some time now as well if folks have anything they'd like to share, initial thoughts, reactions, and certainly any questions I can try to at least make note of and get back to you on. Thank you.
Let's go ahead and thank you for that. And I just am so excited, and PHI is consistently providing us in states with really useful tools and data as we do our work. And so this is just kind of another one that we can have in our toolbox. And I don't think anybody on this call is surprised at North Carolina's ranking, although we're not happy about it. I don't think it's surprising, and hopefully we can use this to elevate many of the things that we continue to work on. So why don't we go ahead and just open it up for questions? And as I'm trying to look to see if people's hands raised, if you have something on your mind, don't be shy to just take yourself off mute and go ahead and ask it.
Yeah, good morning. My name is Jeff Horton. I'm with the NC Senior Living Association. We represent assisted living providers in the state. I was just wondering, healthcare comes up a lot. Every time we're talking about direct care workforce, many of them don't have healthcare. I know expanding Medicaid in this state, which hopefully will get done this year, would probably cover some of those folks. But have any states developed programs where they had a special type of insurance or something where they provided health insurance just to direct care workers, just to get them to stay in the profession?
Yeah, thanks for your question, Jeff. So the simple answer is that I think you're right on track in terms of Medicaid expansion, since so many direct care workers are covered by Medicaid. And there are studies showing that that expansion helps not only provide more services that help family caregivers stay in the labor force, but then also helps the actual workers be able to be covered by health insurance. There are some other programs where states were specifically talking about expansion. I know that there are certainly in areas where home care workers, for example, have more union density coverage than they have included in their collective bargaining agreement. And so that's a much more targeted policy because it is bargained with the state partner. So that might be somewhat addressing. I know that was the case here in Oregon and in Washington state, but I'd be happy to look into other examples. I think it's a really important question.
Thank you. I'll go ahead and I will say the Medicaid expansion is, of course, a priority of the Coalition on Aging, and we have done some work with Care for Carolina, who is our kind of leading our way with Medicaid expansion. And before I acknowledge you, Trish, I'll say that we are planning, and Trish is going to be drafting soon a blog article for Care for Carolina specific to direct care workers and expansion. So Trish, let's hear your question.
Good morning, everyone. And Lina, this is so exciting, and we are really appreciative of all of this incredible data. I wanted to kind of flag the wage competitiveness measure and kind of direct people's attention to that measure specifically. And I was wondering if you could just spend just a few more minutes talking about that measure and some of the methodologies that went into creating it, because I think that could be really important in a state that is as rapidly growing as North Carolina is, and working so hard to bring, as much industry as possible to it. So just wanted to kind of invite you to flesh that out a bit for folks.
Yeah, thank you so much, Trish. So full disclosure, as Heather mentioned, I am relatively new to PHI, so I cannot take any credit for including this measure, but I think it's brilliant and super helpful. My understanding is the way it was developed is there's a data set, ONET, that shows the different, basically they call them job zones, and it's based on entry-level requirements, larger certification levels, so they try to approximate where folks can move in the labor market without additional workforce development investment. And we see, based on the research, that folks actually are moving and turning between different types of caregiving, between retail, et cetera, as you all, I'm sure, are much more familiar on the ground. And so in all states and the District of Columbia, when we take the median wage for jobs in similar job zones to direct care workers are earning at least, I think it's $1 something or $2 per hour less than those similarly ranked jobs. And that's the median wage across the board, not for entry-level jobs. And so as you can imagine, that means that very understandably, folks see this job, even if they're feel called to do it, love the work, that there's clearly a wage advantage to changing industries in a lot of cases. Does that answer?
And in North Carolina, it's even higher than, or lower, I guess, than $2. It's $2.75 is my understanding. So just wanted to flag that particular metric for people. Thank you.
Yeah, thank you so much for noting that.
Awesome. Thank you, Trish. And Heather Altman.
I was, thank you, fabulous work and presentation and all this information. I was surprised for North Carolina, the immigrant percentage, that it was only 6%. I know in when I look at national data, sometimes I've seen as high as 25% is what I've been quoting. And in my own experience working in long-term care, I see that to be the case. So I was surprised that, and so I'm curious about that number, 6%, whether that sense is accurate or whether there is some underreporting. I'm not sure. You're muted.
Sorry about that.
Yeah.
Yes, excellent. Oh, I am so grateful for you observing that and asking about it, since a lot of my work as a labor sociologist is with migrant workers. And so 100% correct. There is underreporting. We know these are all of the nationally available data sets. So PHI and several others usually have a footnote, but I'm glad that you bring this to our attention, because for very understandable reasons, these data sets do not capture migrant workers to the same extent that they're actually present and hugely valuable, important parts of this workforce that has been getting more and more attention as well. And so I was also surprised to see that from North Carolina. I also noted it was quite low for Wisconsin, whereas our partners on the ground tell us that's not necessarily the case. And so, yes, these national data sets, I think that's an important caveat and limitation to see across the board. So they are consistent is the good thing, right? That they're consistently limited. And so these comparisons are accurate. However, we know that there are folks who are not being fully captured here. And so I think it's really important that folks like you raise that up and continue to elevate the particular barriers that different groups of the workforce face.
And I'll chime into that too, because I think from a North Carolina perspective, that was something that hit us early on, at least the coalition and some of the work we were doing with PHI. And I'll lend to you, Heather. One of the barriers that we have identified is some of the limitations is the lack of training and testing in foreign language for the certified nurses assistants. So that's been an identified barrier, and that could be part of the reason our numbers are lower, that we're not able to offer and test in CNA training in foreign languages other than a testing in Spanish. So some real opportunities there, I think, for pipeline issues, and maybe to expand if we can reduce that barrier. Yeah. So thank you. Thank you. And I appreciate just your willingness to come to the coalition, give us a better understanding of the index, and also really the availability for people to reach out to you later as we maybe share this with colleagues or dig into it deeper, to be able to reach out to you and get some clarification. I can't thank you enough for being here on a Friday to share that with us, and feel free to join us anytime again. So welcome, and thank you so much for sharing, and glad you're available. Thanks so much.
Thank you.
Yeah, no problem. And now we'll move on to speaker number 3. It's like speed dating or something. We're just going to do back-to-back sessions. And so now getting our head around federal updates. And so what's been going on in Washington, Inflation Act, the budget in December, now we've got a new year and all sorts of good stuff. And so I would like to welcome you, Howard, to the Coalition on Aging. You are a friend to us. I told the group earlier that you did come down to North Carolina and presented at one of our annual meetings. And I'm not quite sure what year it was. I was thinking maybe it was 2018. Mary Bethel isn't here to welcome you, but I know you've got some friends and former colleagues on the phone today, so and through Zoom. So welcome, Howard. I'm going to turn it over to you, but we're just really grateful for you bringing your expertise for what you do at the National Council on Aging in your role as government relations and advocacy. I know you've been extremely busy, but you're just a great resource to us as we are sort of, from your perspective, probably a grassroots group that wants to do good and lift up voice and create change for older adults in North Carolina, but also to lend that voice in Washington where we need to. So I'll go ahead and turn it over to you, Howard. Thank you.
Great. I'm assuming everyone can hear me. If not, let me know. Yes, I have such fond memories of coming down there and joining all of you. Pre-pandemic is how I kind of remember it as well. And I wanted to say hi to Ellen. I see she's on the line, our wonderful falls prevention friend and colleague. And please give my best to Mary. I didn't see her on. And, you know, I miss you guys. We have been stretched thin over the last few years, but we're bringing in some new staff. And I hope going forward, we can keep in closer contact. So I'm going to run through two areas. One is some of the key aging provisions in the so-called Consolidated Appropriations Act, which sometimes people just refer as the omnibus bill that passed in December. And then talk a little bit about this next Congress and some of the opportunities and challenges. So I'm going to jump in. Three areas that we sort of looked at the omnibus bill in terms of some of the things that we thought were important to older adults. First, there were some health provisions that we were very pleased to see. One of the areas that has been garnering much needed attention is mental health and behavioral health services and substance abuse issues. And we were really happy to see that Medicare coverage for certain new workforce providers was added to the bill. Coverage for marriage and family therapists and licensed mental health counselors. My understanding, and don't quote me on this, but someone told me that that's going to add somewhere around 300,000 new providers that can really improve access to those important services. And as many of you may know, the rate of suicide among older adults is higher than any other age group. So it's much needed. We do a lot of work on Medicaid issues and particularly on home and community-based services, and we'll continue to. And there are two programs that had been slated to expire that are popular. We wanted to make them permanent. The Medicaid Money Follows the Person program that identifies folks in institutions that can come back into the community, and spousal impoverishment protections, which are mandatory for nursing home spouses under Medicaid, but had been optional, now mandatory. Those are extended until 2027. We were also concerned about potential reductions in the Medicaid match for Puerto Rico and the territories. We were able to keep them quite high going forward, so we were pleased about that. And one of the Medicare provisions we were happy to see is an extension of some of the telehealth waiver flexibilities. That's an area where there's a lot of bipartisan support around telehealth. Also, even though this was in the appropriations bill, I think it's relevant. We were very pleased, and I'm going to circle back to this. There's a $2 million demonstration project under ACL to improve the direct care workforce. I know that's an issue that we're all very interested in, and I'll come back to it, but I think that's kind of a health provision too that I wanted to mention. In terms of other budget and appropriations, you know, our primary focus has been on the Older Americans Act, and we got some pretty good increases. Bear in mind that some of the major increases that we got during the pandemic are kind of winding down. Some states have used the money, other states haven't. I'm not sure what the status is in North Carolina, but we are going to be facing kind of a cliff. But we were pleased to see some meaningful increases in the Older Americans Act. Home delivered meals, I think, got the biggest bump. It was 291 million, went up to 366 million. Congregate meals went from 515 million to 540 million. Supportive services went from 399 to 410 million. And the National Family Caregiver Support Program, I'll circle back to the caregiver issues too, were increased from 194 million to 205 million. Those were kind of the larger increases. There were some smaller ones that we had worked on that we were very pleased about. And, you know, I mentioned the work we've done with Ellen on falls prevention. And, you know, the North Carolina Falls Prevention Coalition is one of the best and most active in the nation. And we love to work with those guys. We finally got a small increase in the falls prevention dollars, an additional $2.5 million from the Administration for Community Living, and a $1 million increase for the Centers for Disease Control falls prevention pieces. So that was exciting. Also, in the last Older Americans Act reauthorization, we finally got a new provision that we had been fighting for a long time to create a new research, demonstration, and evaluation office there. And we hadn't been able to get it funded. There are a lot of things in the Older Americans Act that are authorized but not funded. But in this bill, we did get $5 million for it. It's a start, and it's going to be focused on falls prevention. So, we're thinking about what kinds of opportunities there may be in terms of research, demonstration, evaluation on falls prevention with that $5 million. So that was great. We also, on the Medicare side, work very closely with the state health insurance assistance programs, or SHIPs. We've been fighting to try to get more money for them. I mean, look at the demographics, look at the complexity in Medicare. We were hoping to get a lot more, but we did get a little bit over a $2 million increase for the SHIPs. Section 202 housing got a nice increase, $42 million increase for that low-income housing program. And we also do work on home modifications, and that allocation was doubled, and it was increased from 15 million to 30 million. So we were very pleased about that as well. The other area where, probably some of the biggest improvements were made, I don't know if there are issues that you guys follow too closely, had to do with retirement savings. A couple of years ago, there was bipartisan support for what was known as Secure 2.0. And in December, they passed, the first one was Secure 1.0. Now it's 2.0. And, the bill was very bipartisan. It passed by huge margins in the House and the Senate Finance Committee. And it was criticized as focusing probably a little bit too much on people that already had good retirement savings and wealthier folks. So we chair the National Coalition of Aging Organizations for a year. Our term ends in June. The Leadership Council of Aging Organizations. We were able to rally folks to really get a few provisions that may not have gotten in there otherwise for lower and moderate income workers to save for retirement. 4 that I thought were worth mentioning. One is an improved refundable savers credit. Now, refundability means that people that don't pay any taxes are eligible for it. So new low income opportunities. It has a government match and can really help, not a lot of money, but can really help some low and moderate income workers. New emergency savings incentive that will permit people to withdraw up to $1,000 from retirement accounts without any penalty. And, we've seen surveys that shows that so many people don't even have $500 to use in case of an emergency. So this could be very helpful. We've been pushing to get better retirement accounts for part-time workers. Current law said you had to be working part-time for at least 3 years. We got that down to 2 years. And then, you know, a lot of folks don't invest in retirement plans. And there's very good data to show that if you do it automatically and give them the opportunity to opt out rather than having it all as opt-in, you'll get much greater participation. So we were able to get provisions that new 401k, 403b plans will automatically enroll all the employees unless they opt out, with certain exceptions for certain kinds of groups. So that's my quick omnibus summary. And I thought maybe if anybody had some quick questions on that before I talk about the new Congress, happy to do it, or happy to do them all at the end, whatever you guys prefer.
Let's see if there's questions now.
And I think, Heather, I saw you put the link into the chat. That is, I basically summarized what was in that document, so you can find it all there.
And I'll say there is a lot of concern on that cliff here in North Carolina and trying to gear up in our session here to make sure that we're not experiencing that cliff. But it was a tsunami of money that's been received in the home and community-based services, and they've been spending it. Yeah, I see Elisa, and I bet you're going to talk about retirement savings.
Yeah, I just wanted to say thanks for your overview of what's going on at the federal level and the funding. I'm so excited to hear that you're talking about retirement savings. I really haven't heard much buzz about that until this year here in North Carolina. ARP has kind of been like the only voice, and I'm really excited that we're getting more people understanding that if you want to have a financial health security as you age, you really need money. You know, that you really need that, and you need to start saving as soon as possible and make it easier. So that's great. You know, we don't need to get into all the details of those programs, but we're trying to do one at the state level that would help the low to moderate income people have access to save from their paycheck easily, because they're 20 times more likely to do it that way. And I know what you're talking about, the emergency savings, and I think we could cover that, because if you do a Roth IRA, you can take out the money without penalty. So I think it could kill two birds with one stone, in case any of you are wondering about the idea of needing that money as an emergency. If it's a Roth IRA, which most of these people would be, the people that we're trying to serve would be eligible for, would be able to access that funding. So we're working on it at the state level. Yeah, I think that federal fix and Secure 2.0 is really more for the fixing the people who already had access, but it's still great and we really love it. But we still need to address the lower to moderate income people that work for small businesses that don't offer anything. That's all.
Absolutely. And I have to tell you, ARP was a great partner on that issue, like they are on prescription drug and caregiver issues. And I learned a lot, and look forward to working with them to figure out if there's a Secure 3.0 that we might come together on. But, you know, we have a relatively new CEO, Ramsey Alwyn, who's now been with us for the last 2 years. And these are issues she's very passionate about. That's her area of expertise. So look forward to continuing to work with you guys on it. And thank you. So yes, Ellen, go ahead.
Yeah. Hey, Howard, great to see you. A couple of quick questions. I didn't hear you say anything about an increase in Title III-D funding.
It was a very modest increase. Yeah, and I think it was just a very small amount. So not as much as we would have liked.
Okay. And the home modifications doubling from 15 million to 30, that's great news. We have a healthy aging task force that the North Carolina Institute of Medicine is actually heading up right now. And certainly that's part looking at the home environment and safety and so on. That's part of what we're focusing on. So could you just talk for just a minute about what the home modifications allocation entails?
You know, I am not the right person to ask about that, but I can circle back to you and give you a better answer. As you know, Kathy Cameron is the one who's been working a lot with the folks at USC. But I did want to mention it, but it's not an area that I've got much expertise on. But so let me I
can follow up with Kathy.
Okay, I'm sorry. And it's unfortunately not directly related to capable, but I wish we could do more on the capable side. There is a lot of interest in that I saw in the chat.
Great, thanks.
I've got a pretty hard stop around 11. Could probably go a little bit longer. So let me and we can circle back to additional omnibus questions too, but let me give you my sense of where we are in this next Congress, which is very interesting politically, because as you know, it's now divided with still very small margins in the House and Senate. I don't think we're going to see any big bills. It's going to be hard to find bipartisan opportunities. And frankly, most pundits, including myself, think that the Senate in a couple of years is likely to flip back to Republicans, because they're, I think, 23 Democrats up, 11 Republicans up. I don't think any of the Republicans are vulnerable. 3 or 4 Democrats are vulnerable in West Virginia, Montana, Ohio. So we're not going to see any big, bold, trillion-dollar bills happening anytime soon, because not only won't it pass the House, but not even the Senate is going to try to have any of their members take really difficult votes. 2 North Carolina House members I wanted to call out. Virginia Fox, who is going to be the new chair of the Education and Workforce Committee. Under Democrats, they call it the Education and Labor Committee. The big area in her jurisdiction is Older Americans Act reauthorization, which I don't think is going to do much this year, but I think next year I anticipate that could be something that will move, and we will be working very closely with her staff, and she'll play a real leadership role on that. Also, a committee we work very closely with that has jurisdiction over Medicare and Medicaid. A Republican member from North Carolina from the 8th District is Richard Hudson. So he's an important member. I wanted to particularly talk about 3 areas that I'd already mentioned where I think there are opportunities for us to work together, and I'm cautiously optimistic we'll be able to make some progress. One is on the Medicaid home and community-based services front. As you know, we tried with many other groups to get a multi-billion-dollar investment in Medicaid HCBS that almost made it over the finish line, but not quite. The new chair of the Energy and Commerce Committee, Kathy McMorris Rogers from Washington State, has a child with a disability and is very interested in these issues, and has a really good staff person. And she's interested in doing something about reducing or eliminating Medicaid HCBS waiting lists. So I think there's a real opportunity there for some bipartisan support. The big question is always going to be, how much does it cost and how are you going to pay for it? But that's an area that we hope we can make some real progress on with regard to Medicaid and home and community-based services. We're still going to push for the big enchilada. As a matter of fact, just yesterday, the big Better Care, Better Jobs bill from Senator Casey and Congresswoman Dingell was reintroduced with 40 Democratic co-sponsors. I don't see all of that moving, but maybe we can pick off some pieces. One of them in particular, the second area that I had already mentioned, had to do with the direct care workforce. I think that is viewed as the real priority. It's quite the crisis, as all of you know. You may also know that NCOA got a big grant from the Administration for Community Living. We're doing a lot of work on the programmatic side, but also I'm working on the policy side, and they're both state and federal legislative issues that we're working with a bunch of other groups. And Heather, I heard you mention the Paraprofessional Health Institute, PHI. They know more about this stuff than anybody, I would argue, and they're part of our grant. And they've written some really wonderful reports on both federal legislative and state legislative areas that could move things forward. Not only legislative, some regulatory as well. And I would strongly suggest that, if you guys are looking at state efforts, that you take a look at the state report. I'm still getting up to speed on this. We're in conversations with lots of different groups to identify, where the bipartisan opportunities might be. And I understand the issues within nursing homes as well. The shortages are very troubling. And, I think that we need to try to pull them all together. It's both HCBS and nursing facilities that are experiencing this. And you know, the easy solution is to give states targeted money, but trying to get that over the finish line in this Congress could be pretty difficult. So we're still working on developing our priorities, trying to better understand what may be incremental changes, and what things we can do on the administrative and regulatory side. So it's a top priority, and love to work with you guys on it more. The caregiving issue has, I think, some momentum. You may know that the RAISE Family Caregiver Support came out at the end of last year. It had lots of different recommendations, primarily things that the agencies could do. A lot of groups commented on that, not only AARP, but National Alliance for Caregiving. We submitted comments. I think that's a real priority. There are a lot of members that understand that we need to do more in the caregiving space. Republican women, I think many of them are understanding and sensitive to it. So I think there are real opportunities on caregiving, again, largely incremental. One of the areas where I know there's bipartisan support has to do with Medicare and Medicaid dual eligible individuals and how to integrate some of those services. There was a request for information put out by 6 bipartisan senators at the end of the year to ask about those issues. And I think we're looking at seeing how we can move that forward. It's an area that we're going to be concentrating on. As I mentioned earlier, Medicare low-income protections is an area we're also interested in. There is low-income outreach and enrollment funding that the authority technically expires October 1st. We provide technical assistance to CHIPS and AAAs and ADRCs, and we're hoping that we can get a little bit of additional money because the prescription drug provisions of the Inflation Reduction Act take effect in January 24. And an area that didn't get a lot of attention, but we worked hard on and is important, is new people eligible for full low-income Part D subsidies that previously had been eligible for pretty poor benefits under partial subsidies. So a lot needs to be done to educate people to enroll in these programs. So we're looking for some legislative improvements there, and a lot that can be done within the Centers for Medicare and Medicaid Services. We're actually putting out a letter with a bunch of groups either next week or the week after on what CMS can do to improve access to low-income subsidies. And we'd ideally like to make major changes to the program legislatively, getting rid of asset tests, increasing income eligibility. Not sure if that's in the cards, but we'll keep going on that front. On the administrative regulatory side, a lot of focus on implementing the prescription drug provisions of the Inflation Reduction Act. The caps on insulin are already in effect. There's going to be a lot of discussion about the drugs that they're going to be negotiating prices on. The folks at HHS and CMS are all over this, and we're in some working groups, and that's going to take up a lot of attention, and is quite important that we make sure that it's implemented properly. 2 other things that I did want to mention briefly, in terms of the federal budget and the discretionary programs, in contrast to the mandatory programs like Medicare, Medicaid, Social Security, where we fund the Older Americans Act. It's going to be tough because that's the area I think Republicans want to make some pretty major reductions. And a lot of people are speculating that we may just have a full year continuing resolution at current funding levels. But we're going to keep fighting the good fight. There's always this interesting political dynamic where the Republicans want to increase defense appropriations and the Democrats want to increase non-defense appropriations. And usually they reach some compromise and jump off together. We'll see if that's possible, but it's going to be tough to get that done this year, but we'll continue to fight for it, particularly around the cliff issues that you had mentioned. The last thing, which is related to that, and you've probably seen a lot of this in the press, has to do with the debt ceiling, and increasing that needs to be done by June. And there are some very conservative Republicans who want to use that as leverage to cut other programs. And that would be extremely irresponsible in terms of the impact on our economy. I won't go into it. It could be threatening Social Security and Medicare. Frankly, I think politically they'd be stupid to try to do that because even Republicans don't want to cut those programs. But it could impact Medicaid. I think they're pushing to reduce those non-defense discretionary programs. So that's a big fight that aging groups are preparing for. And, we can have discussions about reducing the debt, but we shouldn't be holding those programs hostage by threatening to, kill our economic growth opportunities. So I can stay a little bit after 11 if you'd like, but happy to answer any questions.
You've unpacked a lot there, Howard. Yeah, in a very efficient way too. So just amazed. And you'll see in the chat, Gina Upchurch, who is with Senior Pharmacist, has provided her thoughts on how we can improve the MSP LIS programs there, since you mentioned that. So Gina, I don't know if you want to add anything there.
Yeah, if
your feelings about
could.
SHIP. Yeah.
Yeah, so I'm on the Public Policy Committee for the American Geriatric Society, and they send me all pharmacy related and sort of health equity related things. And actually I talked to the Administrator Brooks LaSure about this as the Vice President of the United States came to our office to announce the Inflation Reduction Act. And I think one of these things really has legs with her, and that is waiving the late enrollment penalty for people, say up to 200%, maybe up to 300%. You want to avoid moral hazard or, something where everybody waits until they really need prescription drugs to join the benefit. But a lot of people, 200 to 300, are using FQHCs, free clinics, and then all of a sudden they need a medicine not covered by that, and the penalty is way too heavy for them now if they've been years without it. So we need to get that waived. That's really an equity issue. And then what we find with SNAP benefits, Medicare savings programs, LIS, the assets test. You save just a little bit of money. You're a single person, you got $15,000, more than $15,160, you're not eligible for anything. So we're punishing people with a little bit of nest egg. So bumping up that assets test or resource limit, I think, is a huge policy to move us forward. And lastly, and I know Melinda loves this, SHIP volunteers, we're going to drop like flies if we have to keep using a plan finder that changes right before open enrollment, and then on the back end reporting that same darn data to a different federal website, the ACL STARS website. It's way too onerous. It's the day of modern age. They need to connect to each other's databases and not torture us, because you're going to lose folks. Thanks. I'm a little opinionated. Thank you.
No, those are issues near and dear to my heart. So I will get in touch with Heather and follow up with you by email. We're all over the asset test issue. I've been working on that one for a long time, but the other ones I'd love to do a deeper dive and share some of the things we're working on. So thank you, Gina, and I will follow up with you on that.
Thanks.
Thank you. Any other questions? And Howard, I'll email you Gina's information. She'll be a wealth of information with you. And if there's not, we'll be respectful of your time. But I want to thank you for giving us kind of the ways North Carolina feeds into some of these national issues, especially with Virginia Fox and Richard Hudson. And if we can be helpful to you in some of these ways, please reach out to us as well. So know that we're kind of boots on the ground here in North Carolina, wanting to be able to support, the efforts that we can.
Yeah, I neglected to mention Senator Tillis. A lot of folks are saying that he could be someone that can bridge some of those gaps and look at bipartisan opportunities. So we'll be following up. And thank you so much. And let's keep in touch.
Yes, thank you so much for fitness, and I really appreciate it.
Sure.
And
my pleasure.
All right, have a good weekend.
You too. Take care, everyone.
Great.
Be well.
All right. So let's see. Now we're moving on, changing gears into looking and focusing on North Carolina. And as we get started with the new year and what's going on at DHHS, Division of Aging and Adult Services, I know so many of you guys have been involved in many of the activities going on with them, with the Age My Way work with the state aging plan. And we're really fortunate to have Rebecca Freeman here to give us an update on all things going on at DAS. And so why don't we turn it over to you? Rebecca is a friend to all of us. I think most of you know her. She comes and represents DAS at our coalition meetings, and we're really excited to have you and having you fill in for Joyce. I know it was last minute, and no worries. We're excited to hear what you have to say and how we can plug in and maybe help you on some of these initiatives. Thanks, Rebecca.
Thanks, Heather. And full disclaimer, I'm not going to bore y'all with all things going on with at DAS. That would be a very, very long presentation, but just some highlights. So I'm going to share my screen. Before I get into the PowerPoint slides, I did want to show everybody, and this will be the first link on the first page of or second page of the slides. The state aging profiles were just released for 2021. And if you haven't taken a look at that, the link will be in the slides that Heather will share. We did them a little bit differently. Sworn already reached out to our comms office, and I think they just look so nice and so professional. There's the state profile, and then there's one for each county, and the front page is hyperlinked, so you can go right to your county if you want to see that. So I'm going to now jump into the presentation. Let me make sure I can get to my slides here. Okay, are the slides showing now? Yep. Okay. So as I mentioned, the link I just showed you is hyperlinked. And the first slide, I'm going to go over our digital equity grant that I'm super, super excited about, that Heather helped tremendously with. Give you just a brief update about some of our social isolation work. Share about the master, which is now being called at the national level multi-sector plan for aging. So we might be changing our language in North Carolina about that. The state aging plan, where we are with that. And then I wanted to share the Governor's Advisory Council on Aging recommendations, which were just sent to the governor yesterday, and the Secretary of Health and Human Services. And then finally, we'll share the 5 senior Tar Heel legislature priorities. So I'll jump right into the digital equity project. So back in the fall, we were notified that there might be an opportunity for state agencies to apply for some of the grant money that the DIT, Department of Information Technology, had been making available to other entities. And so we were really, really excited because my colleague Jesslyn and I had expressed to them that they weren't really focused on older adults, and that was something that we knew was a huge need. And so they reached out directly to us and told us about this opportunity. We put together a small team. We had Heather, we had Amy Lanou from the Center for Health and Wellness, a couple of folks from the Center for Digital Equity in Charlotte out of Queen's University, and then a couple of AAA directors who helped with writing the grant proposal, and we did get it. And so we're so excited. And the main thing for you to know about that is that we recognize that older adults with their, digital equity, it's not just giving them devices. CARES money gave us a lot of opportunity to provide older adults with devices, but there's a huge learning curve with new devices. There's a need for ongoing technical support. There's, broadband itself. And so we are trying to have a really comprehensive approach. We're leveraging multiple funding sources. So we have a different pot of money that's going to allow us to hire someone at the state to coordinate this work. We have another pot of money that's going to allow us to contract with the folks from the Center for Digital Equity to develop a curriculum. And then we're going to use most of this money primarily for training digital navigator master trainers. These will be people who are placed strategically throughout the state, who will then train lay leaders who can go into senior centers, libraries, etc., and teach computer skills. There's a small amount of money carved out for that to provide additional equipment, but the vast majority of that 1.13 million will be for those 16 digital navigator master trainers, the lay leaders being what we are proposing for sustainability. So I will jump to the next slide. Down at the very bottom, you'll see that SILES, if you haven't heard us use that term before, is social isolation, loneliness, and elevated suicide risk. And I'm not sure, since the last time I presented, Heather, if we had told folks about the ASSIST training. So I wanted to make sure that this group knew that we had 2 years ago surveyed our network about the impact of COVID with regard to mental health, loneliness, social isolation, and suicide. And we, found pretty clear, and it wasn't a surprise, that these incidences, folks felt like they had gone up, and staff at the provider and AAA level didn't feel that they had the capacity to address it across the board. And so in response to that, we used some ADRC money to offer some training. So you'll see the BE training. That's a training that ACL has funded with 2 researchers that we're working with. Specifically, the B and E stand for belonging and empathy, and it's really more to address social isolation and loneliness. And so we had 7 virtual trainings for that, and then the people who trained that also took a part too in the ASSIST training, which was an in-person suicide first aid prevention training, if you're not familiar with it. And just, I won't get nerdy on you, but confidence. So since we were working with academic researchers, we were able to get some pre and post research data, and we saw significant improvements in comfort, competence, and confidence. And people who went through the training said that they were more skilled. And so we were really happy with these results, and we're hoping that we will be able to offer more of these trainings I lost my advanced slide, in the spring. And then another thing I wanted to share were just some of the personal statements. I won't read this to you, but we got a whole lot of personal statements from people who went through the training. And I didn't take it. I listened in on the one in Land of Sky, and people were really moved. I saw senior center directors and AAA staff in tears, just really passionate about the information that they were getting. So we hope to continue that. The next thing I wanted to share really briefly is we have found money to be able to expand our True Alta platform for another year, possibly 2. So we're excited about that. If you're not familiar with the True Alta platform, I've included the link on the bottom, but it's a caregiver virtual platform that provides a whole host of resources for caregivers from the comfort of their home 24/7. And we are still looking for ways to keep that going. We're collecting data regularly. So you can see on this slide, we now have past the 1,000 mark with this, which was a big goal that we had. And we have it in 88 of our 100 counties. So 150 new caregivers since November, and we will be able to extend this through hopefully September 2024, but definitely through September of this year. So I'm sorry, the contract runs January to, I'm thinking federal, through December of this year. So moving on. So the Master Plan on Aging, which we're now also calling the Multi-Sector Plan for Aging. Many of you have already heard about this initiative, but just so everybody knows about it, it is a big endeavor that the division and other partners such as AARP, Hometown Strong, Coalition on Aging have expressed interest in. The Master Plan on Aging provides a clear framework for the next 10 years. So it's much broader than the state aging plan. And it's also cross-sector, which means it's not just a health and human services plan, but it'll look across all cabinet agencies to look at what we can do to make North Carolina a state that people can age well in. And in other states where Master Plan on Aging has been implemented, it has had support from the governor and from the legislature. So it's a really big deal, and we're hoping that we will be able to roll this out very soon. We will be having our first steering committee meeting next week with the partners I just mentioned and a couple others. So I have to use the space bar. What we're envisioning the team to look like, we have DAS and the Division of Health Benefits, which is Medicaid, who were accepted into a learning collaborative with a national partner to learn how to do this. And so we are, really trying to pull people together. We envision a stakeholder advisory committee, and kind of in the middle there's a steering committee, which will also be part of the stakeholder advisory committee. And then there will be bunches and bunches of working groups. Joyce and Divya and I got to go to California to see their master plan on aging annual meeting. And the working groups was really where the passion was. There were working groups for a variety of topics that the master plan had chosen as goals. And so those people came in, they actually paraded into this huge conference center with signs and made a lot of noise, and then gave all of their different recommendations. So it was really cool. And we're hoping to replicate that model. And just so you can see what the timeline looks like. So Heather mentioned the Age My Way. We held a summit in October. We've been talking over the winter time. We've been working on a draft for an executive order. It's out of our hands now. It's in the governor's office. So we're waiting to see what happens with that. We will hopefully start convening some meetings in February, setting priorities early in the spring, making sure that the word gets out about it, and then developing strategies through the summer and fall. So we know that this won't stop in November of 2023, but we did want to have a 1-year plan for what we're going to do this year. So shifting gears, and I know I only have about 2 minutes left. The state aging plan.
Don't rush. Take the time you need. Take the time you need.
Thank you, Heather. The state aging plan is underway for 2023-27. You can see there, I just learned this today from Divya. We have a new theme for our state aging plan. It is advancing aging equity with the NC in the middle. So I thought that was pretty cool. And you are probably the first people to know that, other than me and Divya. So you can see the timeline here. We already held our listening sessions this fall. Divya is holding meetings. She just came to DAS and set us all on fire. She's really on top of things, had lots of different people that she invited to the table outside of DAS to get input to this plan. They're drafting recommendations in small groups right now. I got to participate in a couple of those. She has to submit the draft to ACL in March, and then we'll get feedback back. I know Heather is all too familiar with this process, as it used to be her role. And then we will get, we'll go back and forth with the wordsmithing and finalizing through the summer, with you see it being the final submission date has to be by July 1st. So during the listening sessions that Divya and team held throughout the state, which you can see the locations here, there were a lot of overlap in topics, and I'm sure none of these will be surprising to you. Affordable housing across the board, transportation, mobility, pretty much across the board. You see some caregiving, social isolation. We do see digital equity. It came up in a few. We've seen some things on mental health and nutrition. So all of that information will be used to help shape the plan. So the plan is being shaped in the form of 6 goal areas, and you can read those here. So I won't read them to you, but they pretty much reflect what I shared in the previous slide about what was being learned in the listening sessions. So the last 2 updates are not really my updates to give, but I did want to share with the coalition the Governor's Advisory Council recommendations. I'm not going to read these to you. There's quite a lot with the GAC, but you'll have these slides and you can read what their recommendations are. For those who aren't familiar, the Governor's Advisory Council on Aging advises the governor and the Secretary of Health and Human Services. And so, again, a lot of common themes with what we're hearing in the listening sessions, but also what I know the coalition's priorities are. Well, I'm not going to get into all of them. You'll have these to read. And then finally, but you do see the workforce crisis is elevated in the GAC report. And then finally, the senior Tar Heel priorities. These 5 priorities were selected in October. Now, I will tell you, there were also 2 or 3 additional priorities that they are putting forward or recommendations that they're putting forward, including funding for themselves, which I think is long overdue because they don't really have a budget. Everything they do comes out of NASA's budget. So, and then there were a lot of resolutions, a record number of resolutions, which I have to give Woody Brinson, who is the delegate and resolutions chair from Duplin County, a lot of credit. He really, really pushed the new senior Tar Heels and the existing ones to submit resolutions because there had been this gap because of COVID and not a lot of activity. And we had, I think, over 65 resolutions. But you'll see, if you're familiar with senior Tar Heels, a lot of these priorities look really similar. And there was some concern amongst the executive committee and others that, that these priorities are not the only thing that people feel passionate about. And so I do believe they did pass that they will have a list of supplemental priorities, and those are being refined right now. And once those are released, I will share them with you all. So that's it, Heather. Let me know if anybody has any questions.
Thank you, Rebecca. It's a busy time for planning is what I'm kind of one of the major takeaways is just the amount of work going on, whether it's in the multi-sector plan and getting that all engaged, the Institute of Medicine task force on healthy aging, which you didn't even talk about, all of this work. And I'm just really feeling excited that maybe that we're going to keep beating this drum and we've got some momentum around some of these issues. And I've got a couple of questions before I open it up to other people. So I'm just going to take some latitude on this. And I want to thank you for allowing the coalition to be part of so many of the different things, whether it's the Say Aging Plan, helping with the grant opportunity with equity, and just all of the work that we can, help support you and lend our voice. But with the digital equity, because we've heard that need, during the pandemic, after the pandemic, when do you see that grant opportunity and sort of the braided other funding engaging with other people in community so we can see that rolled out? What in terms of the timeline and thought, are you guys going to be reaching out to other groups to help support the train the trainer and some of these other things going on?
That's a great question, Heather. We are currently working on our contract with the Bruce and Zach. I don't know if either of them are on this meeting today, but they're from the Center for Digital Equity, and they're taking a real leadership role. So while we're working on the contract, our contract with them, regardless of this grant, with them was a plan to get a committee together to help inform the work. And now the grant is just going to allow us to do something with the work that was already planned with them. So as far as the contract, Jesselyn's working with Lisa Lewis, our budget officer, to get that rolled out. As soon as we can get contracts signed, that group will be starting to convene. So I hate to say it because I'm reliant on Lisa and Jesselyn, but I want to say by mid-February. And likewise, I've already submitted a request to post a position to have somebody at DAS to oversee it with Temp Solutions. I'm waiting on Lisa Lewis to sign off on that, but as soon as it gets posted, we'll be, getting somebody.
And I know a lot of that's out of your control, but it just helps, especially when we've got people in local communities who get excited and have some creative ideas or partners that might want to lay leaders to just kind of, know when things might roll out. And I will say, whenever you guys are recruiting for positions and things like that, just make sure you let me know in the fold. Sometimes people will contact the coalition if they're looking for something. So please use us to help spread the word on that. One question, I was glad to see you including the presentations on the assist and other things that you guys have done in terms of training on senior suicide risk, because I think that doesn't, and you heard, Howard mention that too, in terms of the rates of older adults, and particularly male suicide rates. I was on, and I'll talk about later, mental health and aging, COVID, telehealthing on Wednesday, and that came up with the panelists, not during the call, but afterwards, about really the older adult suicide rate. So I think I was just glad to hear you lift that up. And then my last thought is around the multi-sector aging plan. And you've talked about California and going out there. I think many people who have been engaged in that work lift California up as sort of the model. And they have really, I thought, what was the great opportunity, not only that there was, leadership, the governors and the cabinet level and the General Assembly, but it was the sense of the private public partnership. And so as you are thinking about North Carolina and where we may go in this direction, how are you seeing, or what kind of opportunities do we have to pull in that private sector in this? Any thoughts on that?
Well, I know it's absolutely something that Joyce and everybody else is thinking about. One of the first things that we'll do when we have the steering committee meeting that hopefully, you're not, I think Mary, no, I can't remember if it's you or Mary, but one of you will be at.
It's me, yeah.
It's you, yeah, is to talk about the stakeholder advisory group and who all should be included, which, could include private partnerships. The other place where, we saw in California, they utilized a lot of private partnerships was around the research and data. And so, that could be an opportunity where we are. Well, I can speak for me. I am very open-minded to any and all partners and figuring out, because it's clearly more work than any one entity can handle. And so the more people that come together, I think the better the outcome will be.
All right, thank you. And I'll open it up to other people who have questions for Rebecca. Anyone? Rebecca is going to get me her final slides, and we'll get those out to everybody. So be looking forward to that in an email, and then also you've got a thought, but also on our website too.
One thing I'll add to the PowerPoint that I didn't include, we had a timeline in our digital equity grant that takes you through the full 2 years. So I'll put that timeline into the slides, and then people can see what the plan looks like. Now, granted, the timeline is also dependent on when we get the funding from DIT, and they are maybe a month or two behind. So it'll be a little bit off, but it'll give you that overview.
Thank you so much, Rebecca. I appreciate you being here and to kind of give us the window into the highlights of things going on, and we'll be able to cultivate this and share it with the rest of the group. And I'm excited to continue to see the development of the state aging plan. I'll add, it wasn't on your slide, and you did acknowledge I was heavily involved with a couple of those in the past, and that report does go to the General Assembly in July too. So it's although they may be adjourning, it's still an opportunity to get some of that same information out. And I think to highlight what you shared with the Governor's Advisory Council on Aging and the Senior Tar Heel, that although not all of the same issues are addressed, what you'll see is there is some overlap, and I think some of that's intentional. As you think and have seen the Coalition on Aging's legislative agenda, we don't totally mirror those, but there are definite themes, and I think you can see those across other groups like AARP, and so the North Carolina Serious Illness Coalition's legislative agenda. And so some of that intentionality, if that's even a word, is that we are demonstrating that there is consensus around some real key issues, and we want to see movement around that. So anyway, thank you so much, Rebecca, and you did a great job stepping up and stepping in at the last minute.
Thanks, Heather.
Yeah, thanks, guys. All right, let's see. I unpinned you, Rebecca, so you're off the hook now. And we are so grateful. I'll tell you, the thing that I love about coalition meetings is that we're really fortunate to get, I think, rich, smart, thoughtful, trusted, knowledgeable speakers every month, and usually in a really timely manner. We've got relationships, and it's due to our membership and connections that we can make just a few phone calls and get really fabulous speakers. And so if anybody ever has a topic or an issue that you feel like needs to be on our agenda, do reach out to me. We want to make sure that we're bringing to you each month the things that you need to hear. We know that we've got a diverse membership and we can't meet everybody's needs every month with speakers. And so there might be speakers that you want to make sure you prioritize this meeting. We've got folks who come no matter what every time, and we're grateful for that. But we know people are busy. And so sometimes it's like, oh, these speakers aren't really my thing. I can catch it later. And that's okay too. We're not really taking attendance to make sure people show up every time. We take attendance for the minutes, but we do want people to be interested. I am making an effort this year to put recordings of the meeting on our website for people who missed it, along with the PowerPoint presentation. So if you missed December, for example, and the demographer, who was fantastic, Dr. Klein had great slides, great presentation. Do go to the website under our meetings tab, and you can see that. I'll be adding this next week too. So I hope that's another way to really capture the richness so people can continue and also share with other people as we go forward. I've learned YouTube channel. So we have a YouTube channel now. So that's what I did over the holiday, was learn YouTube. So it may be not perfect, but I'm trying. So we'll go into coalition updates and legislative updates, and then our sharing. So I will say we have been fortunate to continue to grow our membership through the quiet months of December and January. And I want to give a special shout out to Dwana and Cherokee County. If we had a recruiter position, she's at the Cherokee County DSS, I would hire her in a heartbeat. She has recruited more members over December and January, individuals there in the western part of the state. And so thank you for sharing the coalition. We've got many new members here today, so welcome. And we're glad you're part of our work. So those of you, I've been nudging you about membership. Membership's looking good, but there's still some organizations and individuals that need to renew. So I'll keep nudging you, and we'll get those numbers up in terms of our revenue. And we're just grateful for the continuity we have in memberships. So all of that's great. I wanted to share with you, many of you were able to attend our in-person Connect with the Coalition meeting that we had last week. It was an effort to get folks in person. We didn't do anything over the holiday in December, but kicked it off with a new year. We had the excellent hosts at Association of Home and Hospice Care. Kathy Smith was there. Susan Harmuth, who's with the foundation. We used their conference room. They were fabulous. And we had about 22 people who came and had great conversations. So we didn't have to worry about pesky meetings. People could leave work a little bit early and do a drop-in, and just fantastic, and a good variety of conversations I heard across the room, from Medicaid utilization to vacations and job openings. And so just really nice to get people in person. And I think those of you who came enjoyed it. And so we'll be looking to do something like that again. For those of you who are in kind of the Raleigh area, we'll be scheduling one in the east in Greenville, probably in February or March. So still want to keep that, although we're going virtual this year, keep that in-person stuff continuing. I'll also, we did a diaper drive for the Diaper Bank of North Carolina with incontinence supplies, and I have an enormous amount of diapers in my SUV, which are going to be going to the diaper bank. Really successful, and I think timely for many of our members who are also family caregivers. And so it gave them an opportunity to share some supplies that they had in their house. And anybody else in the Raleigh area, if you have anything that you would like to add to that donation, I'm happy to come by and pick it up. So just reach out to me and we can make that donation even bigger. So glad to drive around and do that for those of you. So, and if anybody has other ideas as we move forward of ways to engage and make sure that we're staying connected, I'm always happy to hear it. I mentioned a little bit ago that earlier on Wednesday, I was part of a NCDHHS fireside chat in Teletown Hall with Dr. Tilson and Victor Armstrong, and really went well. I thought I was excited to be included as a coalition executive director as the conversation. It focused around caregiving older adults, COVID, loneliness, and mental health. And just as a couple of points there, I know I'm really proud of the vaccination rates of our 65 and older population in the state. Everybody in the aging network and healthcare systems really rallied to make that happen. And in my view, are the rock stars of vaccination. They did make the point that of those 50 to 64, 20% have only 20% have gotten the updated dose. And then of those 65 and older, the updated dose is only 31%. So although many older adults did get the initial vaccine, there's still some work to do on those extra doses. And so I just, there are tools on the DHHS website. Many of you are doing vaccination outreach and even doing shots in arms, but something to keep in mind. And I will say, after the call ended and we had a chance to kind of debrief and talk, they were really excited and I think surprised at the interest in this teletown hall. They had never had one around older adults before, imagine that, or mental illness or mental wellness. And so I think they were floored that we had over almost 12,000 people watching that, and that many of them stayed on till the end of the call and had great questions and really engaged. And so they've marked it down to do something else like that in the past. So thank you guys for getting the word out. It was very successful and I think eye-opening to some leadership there in terms of the needs of older adults and caregivers around these topics. Let's see, just a couple updates. These are kind of, I'm looking back, we were able to be involved and contributed some quotes that were shared in the last update in the News and Observer and the North Carolina Health News. I was able to talk about the need for a multi-sector aging plan and some other things. Trisha's been working extremely hard since she came on 6 weeks ago on getting up to speed on all the things direct care worker, and so much overlap, not only on the training piece, but all the elements. And you could hear it just in the conversation today, all the national attention and collaboration going on at the state level. So continue to move forward on that. I will share a couple of updated things that we are working on for the new year. I will be co-hosting or a panel moderator for the Food Insecurity and Nutrition and Aging Adults. This is through the North Carolina Alliance for Health. It's going to be on February 10th at 10 o'clock. And so we've got Amanda Holliday from the Gillings School of Public Health at UNC, Neil Curran, who's with Reinvestment Partners, and Linda Miller at the Area Agency on Aging in Charlotte, but she's also on the National Senior Nutrition Association as well. So that it's a good opportunity to leverage the partnerships and the collaborators that are part of the North Carolina Alliance for Health. Aging usually isn't a topic that they take on. They primarily focused on a lot of children's health issues. And so we're doing this in partnership to kind of open their membership's eyes to some of the needs there around food insecurity. But it's open to everybody. And I think we've got over 80 people registered already. So I'm excited about that. I mentioned that we'll be working on the Care for Carolina blog on Medicaid expansion. And we are in the planning stages of our day at the legislature. So in the update, I've told you to mark your calendars for February 28th. That's still the case. We've got the legislative cafeteria reserve. We're working with AARP, Friends of Residents, NASW to help develop that work. And so it will be in person. I'll be sending out some more details of that, what we're going to do and where we're going to meet and how to set up meetings. But really excited about being able to do that in person and happy that we're got great collaboration and moving ahead. wanted to share with you just about the diversity committee update. We had a January 13th meeting of the Health Equity Committee and all the subcommittees, and we were able to share those recommendations that the subcommittees are working on. And so that Friday, we kind of briefed each other on topics they're putting together in formal format, unified formal format, the topics that they have been focused on and their recommendations. So that effort is continuing to move forward. Really excited and pleased about the engagement and richness of the conversation. Daryl and Laura have done a great job leading it, but the subcommittee chairs have also done a fantastic job and just put in hours and hours of meaningful work. So as we move forward into 2023, you'll hear many more things about the work that we're going to be doing with equity and inclusion. And a shout out to Rebecca for that title for the state aging plan. I should have mentioned that earlier, but really glad to see the focus on equity there. I'm going to pause and take a sip of my water, but I'd love if anybody has questions or wants to add about some of the recent and future things the coalition has been doing, do that. And then after I get my sip of water, we can move into the legislative part of the conversation. All right, no questions. All right. So here we are, January. The long sessions has started January 25th. Some of you who do this all the time and live this world know that we are in a biennium session. So this is the beginning of a 2-year long session that we established that budget for 2 years. So it's a really important year. And that's why we're doing our legislative agenda and coordinating with so many other organizations and having Legislative Advocacy Day. And so each year, each chamber takes turns in who's going to do the first stab at the budget legislation. And so this year it is starting on the House side, which is what it is. I don't think there's anything, but it's kind of a way to focus the beginning of the efforts. The committee assignments have been made. I've shared those in the updates. You can go on the website and see those past updates if you want to go back and see the links for that, but we know those key assignments have been made. Health and Human Services appropriation, House Health, Senate Health. The House does have, and sometimes they haven't seen very many bills, but it is the Children, Families, and Aging Policy Committee. The bill drafting and filing calendar has been announced, and crossover will happen on May 4th. So there are specific days in which you have to draft specific types of bills when they need to be filed, and they have to meet that crossover date by May 4th for them to be considered on the other side. So those calendars with those certain kinds of bills, I'll put in the next update, which will come out next week for those of you who are watching that. But things are really, starting to gear up. The committees haven't started really functioning in terms of what they're going to take on, what their dates and times are. Those could all change in the weeks ahead. We know Medicaid expansion is going to be continuing to be an important and dominating conversation on health and human services, the end of the public health emergency, Medicaid rates, and the end of the COVID temporary rates, and as well as what we need to continue in a state budget that would have equitable Medicaid rates that really cover the cost of services. But on the other part of the picture is education, and in the Leandro case, redistricting. We know state agencies are having huge vacancies of nearly 25%. And so looking at state employees and workforce issues across the board, not just critical health workforce issues, but others as well. So I know many of you are working on this front. Some of you are working day to day, taking care of people and communities. And so it may not be as important, but I will say that each of us has an important voice in this, whether you're an expert in a local community, knowing what your your clients need or the people you care for. And so we all have a role in the advocacy piece, making sure legislators know what older adults are facing and what the struggles are. And then we look forward to working with you and leveraging your expertise as we're trying to move forward with our legislative agenda. We've got some folks here. I know some of the lobbyists working with our groups, as well as, many of you who are just beginning this work. So I'll just pause and let people add what they've got their eye on, or give some food for thought to some of us as we move forward with the long session. It's going to be crickets. If it's going to be crickets, I'm going to call on Ben Popkin, because I know you can always add something, Ben.
Hey, I can kill some awkward silence with the best of them. No, this is great. It's always a pleasure, obviously, and we're looking forward to continuing to aim for the end of February, I guess, for a good advocacy day. I'm excited about it. And the issues that we've got with Friends of Residents are going to be consistent with what we've looked at in the past. We're really going to be focused on personal needs allowance and upping that rate in the nursing home setting, as we had done a couple of years ago in assisted living. So we'll be revisiting the same legislators. A lot of the chairs of the appropriations committees are folks who've been around and they've heard it. So we're hoping the budget will be supportive of that. And we've definitely been looking at and we'll be emphasizing the need for more ombudsmen, trying to get the state numbers up to where the ratios really should be. We've had, again, we've had some good situations where we've been able to kind of personalize or explain the function and the value of the ombudsman, a couple constituent questions, and nothing horrible, but just to let them know that's always been a difficult argument for legislators. They hear the word ombudsman, but realizing that they're, the service they can provide to residents is really important. They're a really important starting point for resolving things and avoiding escalation, right? So those are really two of the issues we'll be looking at, returning to. And of course, there will be more coming up, no doubt. But those are really where we're going to start hitting first. I mean, we have looked at some other issues, but we're going to aim for those and get some successes and see what else we can help out with.
Great, thanks. You haven't heard about when the governor's budget might come out, have you?
I have not, but
Okay.
things are just getting lively down there. Wednesday was the first day where they really started introducing bills and everything. So I'll put my ear out and see what I can find.
Thank you. And we've got Care for Carolina is having their legislative breakfast on February 1st, next Wednesday. NASW has announced that they're having their legislative day on March 1st. So folks are really starting to, really plan and be mindful in this. So any other thoughts or questions? I'm really wide open. All right.
I was curious, and I wanted to toss out, if you don't mind, to some of the other folks. I was curious to hear the mention of Representative Fox. Virginia Fox, I've heard a lot of her stances on education, of course, is where she seemed to be particularly active so far. But, we certainly could reach out to, Tillis has been, I think, approachable, and his staff. And, if Fox would be a helpful voice in aging, I'd love to hear if folks have had any interactions with her on that.
And she's out west, right? I just can't think of. And so we have some folks who may have some interactions with her on the call, or constituents as well.
We've not reached out to her, but she's strong and been there a long time, and she covers a lot of the West now. So
yeah, that's a good point. I know, if Mary Bethel here, she would have something to say, and I'm not stepping up my game. So there goes the awkward silence.
Yeah, this is
That's
Jeff.
what it's all about. Hey, Jeff.
Hey there. Yeah, and I think I speak for the other long-term care providers also, is our Medicaid rates are still temporary. And we're going to be working to hopefully make those permanent for the Medicaid personal care services programs, and also other long-term care programs. I know the Medicaid rates, they've been extended because the public health emergency has been extended by the Biden administration. However, it's still not permanent, and we face that cliff if the temporary rates were to expire and go back down to a really low base rate that is really not sustainable for providers to pay, wages that are competitive and then stay in business. So that's one of our top priorities. And of course, the SA issue, which you know about. And so those are the things we're going to be working on this session primarily.
I'm glad you mentioned that, Jeff, and you're absolutely right. I think that's the priority number one, those Medicaid rates for a lot of us across the, all settings. And so I would ask, it's top priority on our list. If we can help in any way, please pull the coalition, or if we can, work with some of our members in different locations to add and help elevate that, we definitely want to do it. Because I think, we're in a drastic, dire situation right now, and it's a lot of money, but it's money that needs to be invested in our most vulnerable people so that we can have industries and providers that can support them and cover their costs so that we can provide quality care. And we're at a point where, with the staffing anyway, that people can't access the care that they need and are getting backed up and on waiting lists. And so thank you for that. And I'm guessing, Adam, you've got a little bit to add to this too. So please.
Yeah, no, the same thing as what Jeff said. I was just going to offer just a little bit of a different perspective on it. I think in a recent survey of our members, about 31%, I'm going from memory here, but about 31% currently are operating at a loss, and another 60% are operating somewhere between a 0 and a 3% margin, which is, that's going to fluctuate just based on, changes when it's that razor thin. And that's with all the temporary add-ons. So if our temporary add-ons in, that's about a 16% rate cut in Medicaid. And I think that would definitely drive about 90% or more of our nursing homes into the operating in the red, which there's not much that can be done at that point, except to a negative impact on service access and service levels. So in any event, I just want to make sure everybody understands, as challenging as it is today, that's with these temporary add-ons. Removing them will be a significant rate cut that just really can't be absorbed. Even with the temporary add-ons, the other piece of information just to share, about 48% of nursing homes that responded to that survey, because of workforce shortages, have had to close either beds or wings, whatever, however you want to say that. But already, there are about 10,000 beds in nursing homes across the state right now that there's not enough workforce to staff. So we know there's demand out there, whether it's patients in hospitals or loved ones that are being cared for at home but need a higher level placement, that there's a bed, but there's not workforce to staff that bed. And that's really, that's the barrier. And that is, again, with these temporary add-ons. So even if they're extended at 100% of what they currently are, that's still the environment that we're in. So, the thought of losing them would absolutely and very quickly impact access to care. No question. That's all I'll add, but that's certainly our top priority this year.
No, and I'm glad you did. And, I think of some of the rural areas too, where we only have 1 or 2 nursing homes in a county or a community. And so what does that mean, for rurals as well? I just think, and yeah, that access to care is a critical issue. So thank you for that data, because I think where we can have those really hard numbers at them, even if it helps build the case. And that's often what it takes, is to have that data. And we don't have that in some of the other industries, and where it's really a strength of the nursing home industry. We're coming up to time here, but I don't want to stomp the conversation. I just want to also open it up to folks who might have announcements that they want to share with the coalition. Things that are going on, whether you have a conference coming up, whether you're looking for maybe sponsors or presenters for that conference, anybody who may have some things going on. Yeah, Adam.
Yeah, sorry, Heather. One other thing. I know there's a dramatic difference of opinion out there among the coalition's membership on this one item, but I did just want to share. I think many folks here know that Biden administration announced last year that it was going to be announcing a minimum staffing requirement in skilled nursing facilities in the future. It's been conducting some studies, and I think we expect more information on that a little bit later this year. Don't know exactly what that is going to look like, but did want to share, we've done some analysis, and, all the current hours per patient day of nursing care and nursing homes are all publicly available. But looking at it from a statewide perspective, I think I just want to share this take. I don't know of any nursing home in North Carolina that's not actively and desperately trying to find additional staff. No question about that. And there have been some national analyses on how many additional employees would be needed in skilled nursing facilities in order to meet, various levels of minimum staffing requirements. I think the thing that's not talked about, but it's the flip side of this issue, particularly given the workforce environment that we're in right now. Based on our analysis, assuming that we are bringing in everyone from the workforce who is willing and interested to do this work, given all the resources and the constraints, or however you want to look at that. But assuming we've captured everybody who's willing to perform this work, if there were to be enacted a 4.1 hours per patient day staffing requirement, which is kind of the number that it's from a study that's about 20 years old, but that's kind of the number that's out there, and we'll go with that until we hear otherwise. It would require us, in order to meet that requirement, to discharge about 4,800 patients from nursing homes across North Carolina. Which is it's a pretty shocking, figure in order to meet that requirement for everyone else. It's how do you meet that requirement? Well, we either need to find more caregivers or decrease the number of patients that we serve. It's really, one of the two. And I think everything possible is being done to increase the number of workers in our profession. And if we can't further do that, then the number of people we serve has to decrease. So,
and that 4,800 is a statewide. It would be across, if there was a switch and that became the requirement, like today.
Correct.
That right. Would be what we're talking about.
Yeah, that's based on our current statewide occupancy or patients being served. Today, that number would have to decrease by just over 4,800. So, I just wanted to offer that. I know that, again, we've got a range of opinions in our coalition about whether there should be, some figure, but just, again, wanted to share that based on our analysis, knowing that this proposal from the Biden administration is coming out there. I've seen some things recently that make it appear as though this would be a simple fix to hire more caregivers, and just want folks to know, from our perspective, we're trying everything we know to hire more. The flip side of that is going to be a reduced access to care.
Thanks. And Carol?
Thank you. Yes, I'm with the North Carolina Guardianship Association, an advocate, and you've all, many of you heard Linda Kendall speak recently, one of our meetings a few months ago. Our conference is May 3rd to 5th at Carolina Beach, and everybody who's aging really should be concerned with guardianship, ways to avoid it, alternatives. It's going to be a wonderful conference. We're bringing in national speakers. I think we've talked about, changes that are coming across the country, around the world in guardianship. We even have a session on alternatives for older adults, diversion, alternatives to guardianship. But it will be of interest. Check out our website. If you are interested in doing a table, an exhibit, sponsorship, contact me or go to our website. You're more than welcome. But it's really a hot topic. Changes are coming. We have legislative changes that we hope to see enacted this year, which will help. But an issue for our aging population for sure. Thank you.
Thanks, Carolyn. I'll say it sounds like maybe there's going to be a bill introduced here,
Yes.
and we're watching for it. So with some of those recommendations from the Rethinking Guardianship work group.
Right.
So yeah, I've been told to be on alert. So we'll keep all the coalition members engaged and up to date on that. And I'll just say, Adam, just real quick, because I feel like I maybe transitioned too quickly, but I have kind of heard that there is some movement or advocacy at the federal level to, if you're going to implement these minimum requirements, that you also need to give people tools to be able to help support or do something with the workforce, because you can't address one without the other. Is that at least some advocacy work? I don't know if there's solutions out there, but I've been seeing some that's the push.
Yeah, slow progress, but thank you.
Yeah, thank you. I think Janice, your hand was up next.
One comment on Adam's thing, and then I'll make an announcement about NCAOA. So if I'm hearing you correctly, because we said earlier there were 10,000 beds that were unable to be staffed. So do you add the 10,000 to that 4,000 plus? So that's really eking up to like 15,000. That's, oh, wow. That's scary.
Yeah, Janice, we've lost net about 19% of our workforce since COVID started. So
right.
There's turnover. All these data are out there, but yeah, about 19% of our workforce. And I'm sure Jeff, that there's similar metrics in assisted living. But yeah, based on the number of patients we're serving today, which again, there's about 10,000 beds that are there, so this is not like, do we need more beds? We've got plenty of beds. It's, we need the workforce to staff those beds. But no, this would be actually beds that are occupied by people receiving care today. We would need to figure out some way to I don't even want to begin to think how you would go about that. But yeah, there are people in care today that we would no longer be able to care for, depending on how it's done. But just taking the metric in place that's out there.
So I'm here representing the North Carolina Association on Aging. Just wanted to remind you guys that we do have a conference coming up, and it's in Charlotte. It's March 13th through the 15th. And our opening speaker, I think, is on here this morning with us. Daryl is going to be our opening speaker, and we're so excited about that. So we have lots of good presentations. We are finalizing all of those next week, and we'll be sending out the registration packet. I'm sure Heather will connect on the website and her announcements. So before, we're having a little pre-conference on the 13th that morning, an aging boot camp 101. So if you have folks in your organization that want to learn more about aging, we'd welcome them to come join us for our boot camp before the conference starts at 1 o'clock on that Monday morning. And it is in downtown Charlotte at Pritchard Memorial Baptist Church. And we do have a contract, or not a contract because we can't afford a contract, NCAOA at the moment, but we do have a hotel in downtown that we have a block of rooms with. And then I did also notice, Heather, that you included us, switch my hats here to the Director of Aging in Orange County, that we were taped and we're going to be on NC Impact's show next Friday evening. It's always scary to know what they're going to show of us, you know. So I don't know whether to say go look at it or not, but I hope that myself.
7:30.
Yes.
7:30 on the 3rd, and it's around Alzheimer's, right?
And dementia. It's our work along with our dementia-friendly business work here in Orange County. So,
And I think they're also going to talk about Wayne County too, maybe, is what I was.
I think so. And that happens to be my home county. So I'm excited to hear about that too. So thank you guys so much.
Oh, that's great. Thanks. And you guys are still, for the NCAOA, sponsorships are open too, if anybody wants sponsorship. So, Yep. Okay. And I'll get all that information once you get the registration out, and glad to do that. Ben, you've been so patient with your hand up.
Oh, you know, I talk too much as it is, and I know we're at time, so I'll try to keep this brief, but I have some excellent and sad news to share. Our fearless leader, executive director of Friends of Residents, Lauren Zingraf, has been poached. And she has been lured by, I like to think, fantastic benefits and greater pay and all that we have been able to do, but she has led us fearlessly and passionately for several years now, and it's going to be a different world. But Lauren will be starting as Director of Advocacy, Policy, and Legislation for the National Association of Social Work, and I believe starting soon. So I guess you can't hold a good social worker back too long. But it's been a remarkable experience, and we will miss her in that role, but I trust we will see you in different roles soon. But Lauren, thank you for your years of service to our group. We wouldn't be the same without you. But we'll drag you back in there as much as we're able. So
I know. Well, I hope that means, sorry for your loss there at Friends of Residents. Lauren, you have done a great job. And I know when I came into my role, you were kind of coming into your role at the same time. And so, I just, know what you've done and how hard you've worked with Friends of Residents. But selfishly, I know we won't lose you as a coalition member because you're going to be at NASW. And so a great fit for you there. Anything you want to say, Lauren?
Yeah, I know it's at 12:03 and I know how it goes, but I want to thank everybody for their support when I started. The Coalition on Aging was one of the very first in-person meetings that Bill brought me to introduce me as the new executive director. So it's one of the only times I had an in-person meeting with all of our community partners, because then not even like 8 weeks later of me starting my very new job, COVID hit. And the one thing I want to say about that is that it's not about me, but that everyone on here who is a stakeholder around aging, that we never forget that individuals in long-term care here in this state literally went a year of their life without having contact with their loved ones, without having people come in the building, without seeing their family or their friends, without being touched, all of that. And so that we continue to do the work that we do so that those things never happen again to residents in long-term care. I thank everyone who's a community partner of Friends of Residents. Friends of Residents is an extraordinary organization. It's been here for 36 years. 36 years. It punches above its weight. We might be small, but we are mighty. And part of its success is because it does have community partnerships with so many of you that are on the Coalition on Aging's call. One of our greatest champions has always been Heather Burkhart and Mary Bethel and all that they do to help amplify Friends. So it was a very bittersweet decision for me, because I've enjoyed these past 3 years. I've enjoyed working with all of you, and I enjoyed tremendously the work that Friends does to help improve the long-term care system and ensure that residents are having the best quality of life that they deserve. So I look forward to the fact that NASW is a coalition member. And so I'm hoping that I'll still be able to join these calls sometimes and be able to see some of you going forward. So thank you right here late on a Friday, letting me get these last little bit of words. And I appreciate that, Heather, so much. Thank you.
No, thank you, Lauren. I appreciate it. And I want to bring to folks' attentions who may not have seen it already, but Social Security Administration, Brian put in his updates and links there for each of you. Any other announcements or things to share? I've got a couple little things on my cheat sheet here to make sure folks know if you were interested in community challenge grants from AARP, those quick fix grants, that's now open. The Southern Genealogical Society has an endowment grant that's open until February 1st of $3,000. Dementia Alliance Caregiver Conference is next week. Saw some exciting news this week. Many of you guys know Bill Milner with Access Dental Care. He's receiving the American Dental Association's Humanitarian Awardee, so that'll be in the next update, but super excited about that as well. So always love to see North Carolinians get national recognitions and coalition members. I've added a calendar to the website, so I'm going to be putting in the many conferences going on for Healthcare Facilities Association, NCBAM, Leading Age, Association of Home and Hospice, PACE. On that update, the calendar part gets really long and everybody's scrolling forever. And so I'm going to go ahead and just put all that stuff on the website so people can look at it anytime and get more information and try to shorten up that update for everybody. Anything else as we've gone 7 minutes over? So guys stuck it out. I appreciate it. And I hope everybody has a fabulous weekend and do reach out to me if you have any questions or thoughts or things to share in the future. Good to see you, Heather, for popping on to say goodbye. So thank you guys and have a great weekend.
Thanks, Heather. Meeting adjourned.
Thank you, Adam.
Thank you. Thanks all.
Have a great weekend, everybody.
You too.